Good morning, everybody. Wonderful listeners of Solid 100.9 FM. Once again, to the TESH Glaucoma Awareness Program right here on Solid 100.9 FM. It is your trusted platform for health education and glaucoma awareness. And every week, we bring very important informations that are designed to help you protect your vision and understand that one of the leading causes of preventable blindness worldwide is glaucoma. So today we will be discussing a topic that many glaucoma patients often worry about, and that topic is surgical management of glaucoma. Surgical management of glaucoma. And in this topic we'll be discussing what patients should know. Alright, and in this part of the world, this part of the country, when people hear the word surgery, they often become anxious or sometimes fearful. Many patients sometimes wonder whether glaucoma surgery is painful, whether it can restore lost vision, or whether it means their condition have become hopeless. Well, the truth is that glaucoma surgery is an important treatment option that can help treat the remaining vision of patients when medications or laser treatments are no longer enough. So today we will be discussing when glaucoma surgery becomes necessary, the different surgical options that are available, how glaucoma surgery helps reduce eye pressure, what patients should expect before and after surgery, and we'll also be talking about some common fears and misconceptions about glaucoma surgery, and most importantly, advice for glaucoma patients and their family. And to help us in this very interesting and fully packed discussion, we have Professor Nkirikizo Akeriwe. She is a consultant ophthalmologist, Isut Teaching Hospital, Park Lane, Enugu, and also governor representing Africa World Glaucoma Association Board of Governors. Good morning, ma'am, and good to have you on the program.
Good morning, and it's wonderful to be back again.
Okay, without wasting much of our time, ma'am, let's quickly, once again, as we always do, remind our listeners as to what glaucoma is all about.
Yeah, thank you and welcome again, our dear listeners. And like Chupike said, we just want to do a throwback on what glaucoma is. Perchance you're just joining us newly. Glaucoma is a group of eye diseases that damage the nerve for vision, and they do it painlessly, slowly, but progressively. And they have a characteristic way that they damage the nerve for vision and affect vision. So this group of diseases that's called glaucoma, they usually damage vision from the outside in. So the person who has glaucoma does not know that they have glaucoma till late in the disease process. This means that somebody could have like 90% of their nerves damaged and they don't know, because the center vision is the last to go. And because somebody is still seeing well, looking ahead, the person is still seeing well, they presume their eyes are good. But when we qualify vision, we qualify both in distance and how wide. But the damage goes on slowly that the person affected doesn't know so it keeps damaging from without in. And that's why it's called a silent thief of sight. By the time it starts affecting the person's vision, that person's vision has gone almost to 95%.
Wow.
And the person, and at that stage, it is very advanced. So, and that's why we say go check your eyes when you are seeing well, because you never know. 90% of your nerves may have gone even at that stage that you are seeing well.
Well, there's something I usually do since we started having this glaucoma discussion since last year. Every time I wake up, first thing I do is I look left, I look right, and I ask myself if my eyes is okay.
Yes, let me elaborate on what Chibuike said. Because I said that the glaucoma starts damaging your vision from the side
view. Yeah.
Yes. So when you're looking straight ahead, you spread out your two
hands,
two arms, there's a point where you can see both fingers moving while still looking ahead, not looking at them. Okay, so and you can close one eye and check, close the other eyes and check. So if you think you're seeing well, your hands would almost be 90 stretched out 180 degrees, almost, and you will be seeing them on both sides. But gradually it begins to narrow. That width of how much you can see begins. So now you think you're seeing well, check it and see how far you see with your arms stretched out. And every morning, like Jubilee is now saying, when you wake up, just check it and make sure you're still seeing that far. And apart from how wide, actually over a third of our patients, almost 40%, come in with one eye gone already, and they didn't know. So
the damage does not affect both at the same time.
It doesn't affect both at the same time at the equal pace.
Okay.
Yeah. So it usually affects both sides, but a number of times one is worse than the other. Yeah. So if you at least even pick up that one eye is gone, then you would be able to come to hospital to find out what happened to it. But many times people don't know that one eye has gone because they are seeing with the second eye. They think it is the two eyes that are working. Yeah, so they don't know. It's when that remaining eye starts being affected in how it sees. Meanwhile, the time the blind eye went, this other eye had been damaged like 80%.
Damn.
But they don't know. They didn't even notice one had gone. So it's when this one now reaches about 95%, and it starts affecting how they see, that they now feel that I'm having some smoky vision. And at that point it's quite late. So check when you wake up every morning, check how far you see, in terms of distance. Close one eye and look, close the other eye and look. So you're cross-checking the two eyes. Then stretch out your hands by your sides and see how far you can see that way. Then stretch out up and down and see how far you can see without looking at your hands. And so once you're able to gauge how far, you check it every morning. When you see the circle, it's beginning to close up, you know that there's fire on the mountain.
But that does not mean someone can also go for proper check.
It doesn't mean at all, because when you want to wait for that stage, even
problem already started.
Yeah, it has gone far. I'm telling you, it's gone far.
Okay, and that's why this program is very important, and that's why you should always take every discussion that we are having every Friday very important, because to be honest, I do not know anything about eye, but since we started having these discussions on radio, I am getting very familiar with all of that. So today we said we'll be talking about surgery. Okay, and the topic for today is surgical management of glaucoma, and we are going to be enlightening you all about what patients should know. But okay, we are not on schedule, but let's quickly dive into this one. What was, will I say, surgery is part of the treatment of glaucoma, right? Is it like the treatment given when the thing is more advanced, or more like, because I have money, let me just go for this one? When does it become necessary?
Okay, thank you very much. As we had always said, that there are three major ways of treating glaucoma or managing glaucoma. That we have medications or eye drops. Okay, we also have laser, which is machine treatment, and we have surgery. And like you said in your introductory remarks, that people, once you say surgery, in fact, they say, hey, and but apart from that, there's just been some circulation of wrong information, that myth that glaucoma, you don't do surgery for it. So people come, and when you tell them we need to do surgery in your eye, they say, I thought they don't do surgery for glaucoma. So we want to categorically state here that surgery is one of the important options of treatment of managing glaucoma. So surgery is done for glaucoma. Now, when do we do surgery for glaucoma? Yes, like you said, if it's advanced glaucoma, you want to do surgery. Surgery is the fastest way of bringing the eye pressure down and keeping it down. And surgery is the method that gives you the highest drop in pressure. Now, we had talked before that anytime there's glaucoma, the major thing we treat is to bring the eye pressure down to a level that is safe for that eye. We call it the target pressure. Okay, so now when the pressure is very high, it's usually unlikely for the other methods alone to bring it down to a low level. So when the pressures are very high, you're more likely to have surgery done. That's one. Then secondly, there are some eyes that don't respond to other types of treatments. So give all the medications in the world, the pressures remain high, and such eyes must have surgery if the eye wouldn't go blind. Now, some of our people, we say, let's keep trying, and then they keep trying and they keep trying, and the eye eventually goes blind. So there's no point. It's just like a woman who is about to deliver, and you say, ma, this baby can't come out from the normal way. We need to operate. So you say, no, let's keep trying. And at the end, the baby dies, and maybe the mother's life is also in danger. There's no need for that. So that's when the pressure, there are some eyes that do not respond to other forms of treatment, and you have to do surgery. And then when we see glaucoma in the young, when we see it in a child, when we see it in a young adult, like we offer that because they can't manage medications, and they, particularly for children, there's no debate about it. They do go for surgery. If it's a young adult, depending, they might do well with laser, and then you keep monitoring them until it stops responding, then you can do surgery. But for young children, you do surgery.
I want to ask something. You said this surgery comes when it is advanced. Can someone who very much observant about his or her eyes probably go for a checkup and find out that, okay, I do have glaucoma, probably around 5 to 10% of my vision has been lost? Can the person say, you know what, straight surgery, I want that?
Yeah, person can say that, but because presently we have an option of laser is not intrusive, and if it's a type that can take surgery, that can take laser, that has that's good for laser, then we do laser. Okay, yeah. I've seen people who fit this bill. They said, look, there's no point, and that was at the time when we didn't have lasers available. So the person said, I can't deal with drops. I can't daily I won't be able to. And the person's had surgery done, and they were able to run for years on that.
What's the time frame for this surgery and even for laser? What's the time frame?
You mean the duration?
Yes, before you come again.
Okay, for laser has a duration of 1 to 5 years, an average of 3. Then it's repeatable once you've responded initially. But we've seen patients, who have run up to 7 years after they've done lasers, so but the average thing is 1 to 5 years. Then you repeat it if the person did before. Now for surgery can last a lifetime. Yeah. And but the surgery can also be complicated with scar tissue formation, which might require the patient to be taken back to theater to break the scars, so that it can maintain function. But some people, you do surgery for them, they are good for life, but that doesn't mean they should disappear. Yes, so they still keep coming for checkups to make sure everything is okay, because if scars form and inhibit the surgery to work, it will not inform you formed though. Because there's no pain. Do you get? You won't know that the pressures have gone back up unless you come for your checks. So we'll talk that a bit further.
Okay.
But in terms of advanced glaucoma, when we see it in advanced glaucoma and the pressures are high, why we don't what we recommend is surgery is because you don't want to. The more you're dilly-dallying, trying this, trying that, with this work, with medications work, with laser work, by the time you're trying all that, damage is going on, and what is remaining is very small. Okay, so you want to do something that you will bring it down sharp and immediately. Now, but apart from advanced glaucoma, the World Glaucoma Association actually recommends glaucoma as first treatment in low economy countries, so in cost constrained economies, because medical treatment, which people tend to prefer because they feel is safe, it's expensive. It's actually the most expensive of all the options,
because of constant buying.
Yes, the constant buying, and the drugs are very expensive at this time. It's terrible because it's dollar denominated, so it's very expensive. So when a patient is spending over 50,000 a month, to buy eye drops to keep their eye pressures down, how sustainable is that? And how available is it in different parts of the country? Sometimes someone is in the village and they don't have access unless somebody sends it to them from town. And how do you reach the village? Somebody has to travel. That is also cost. So it's far cheaper to do surgery. So when you see somebody who doesn't have money and the person is dependent, the best thing to do is to do surgery for that eye. So it's the best thing to do, and that we keep that. And our experience and research also shows that when surgery is done early, before drops abuse the eye, we call those eyes virgin eyes. When you do surgery on those virgin eyes, their success rate is far higher than when you do after so many medications have been used.
Come for surgery.
Yes.
Interesting. So this surgery that we are talking about, are there different types of it?
Yes, there are different types of it. There's the major type, which we call the gold standard surgical procedure. That is, every other procedure is compared with it. It's called the trabeculectomy. Okay, so in that, then we have the ones we add some devices inside. They have the ones we call them aqueous drainage devices surgery. And we have the ones we call minimally invasive surgery. Okay, most of the ones that are common internationally, we don't have in the country because they are quite ridiculously expensive. In the light of our own economies. But there are some simple versions of it which we do here in the country. of those minimally invasive types. So those are basically it. But the most common, and every other procedure that is gauged against, is the trabeculectomy.
Okay, can you please just talk about this three procedures that you have mentioned quickly?
Okay, let me quickly talk about the trabeculectomy, which is the most important. Usually, we've said that there's something that produces fluid inside the eye, and it has another channel through which it leaves the eye inside, and the eye pressure is a balance between the two. Okay, production and excretion. But so what we do in surgery, because in most glaucomas there's blockage of drainage, so fluid builds up inside the eye and the eye pressure goes up. So what we do in surgery is to create a channel between the inside of the eye and the outside of the eye.
Okay.
And the outside of the eye is not outside, but under a little cover of the eye, outside there. So the fluid drains from inside out. So that's what we do at surgery, to give it a channel to move out. Now, sometimes scar tissue now form around that area it's coming out. And when scar tissue forms, it prevents it from being absorbed into the body. So that's the major thing. So even the all the other procedures, most of them are all aimed at creating a channel for fluid to have inside the eye, to have an outflow into the body, and to overcome the obstruction, and that way the pressure comes down. So that's the principle that governs surgery.
Okay, and if we are to say one has to have surgery, how does this surgical procedure help protect the vision?
Yeah, just like other methods of treatment, it's aimed at bringing the eye pressure down. So when the eye pressure comes down, then damage is expected to stop or come to nearly zero. So there's been damage, or damage is expected, and all that. And you create that channel to bring the eye pressure down. The low pressure helps prevent further damage from going on. So that's the way it works. Yeah.
Okay, now let's take for example, because I'm just trying for this discussion to be more of a real life experience so people can very much understand. Yes, a patient have been diagnosed of glaucoma. Yes, the advice has been you need to go for surgery. Take for example, I'm the patient, for example. Okay, what should I expect going into that surgery, and what should I expect after the surgery?
Okay. Now, usually going into the surgery, there are some tests, investigations you must do before the surgery.
The test that was carried out to ascertain I need to go for surgery, not enough?
Yes, those surgery, yes, they are enough if you have just done them recently.
Okay.
Yeah, but if it's been some time you've done, we need to know the states before surgery.
Sometimes you don't look for money, and before you come back.
Yes, and that's a painful one. Sometimes the patient has very tiny thing remaining, and you say, look, do surgery before you lose this little one remaining, and they say okay, and then they go, and before they find the money, unfortunately, and come back, that eye is gone. So they now have the money in their hands, but the eye is gone. So I just want to use the opportunity to tell the patients, if your doctor books you for surgery because your vision, what is remaining, is small, and you don't have the money, don't stay away until you find the money. Go back to the doctor and say, I have yet to find the money, so they can find alternative things to do to sustain the vision, before you find the money. So you were asking what to expect for the surgery. So those tests need to be done, And then on the day of surgery, usually we give an anesthetic agent, which helps you not to feel the pains when the surgery is being done. Now, usually we do it under local anesthesia, except the person is a child. Then we do under general anesthesia. And the procedure lasts between 30 minutes to 1 hour, 1 hour 30 minutes, depending on the speed of the surgeon. And thereafter, the eye is closed, padded, till the next morning.
Wait, is it that they'll remove the eyes and clean it? They'll remove it and clean it, or what?
No, so usually the eye, it's a good question you've asked, because some patients think that their eyes will be brought out.
Yes, now on
the
towel and clean
it. No, usually your eye remains where God placed it, and the work is done with it there in place. Just some small incisions are made, and the eye is delicate, so small incisions are made, and all that hole I talked about, space is channel is created, and then you get up and you go back to your bed or wherever, so, and then you're seen the next day. Yeah, so you're seen the next day, and usually your vision is maintained.
It's just to maintain the pressure at that.
Yes, okay. It's just to bring down the eye pressure. So for most patients, I would say 95% of patients, the vision you enter theater with, that's what you still have the first day post-op. Subsequently, some drops might be given to you that might blur the vision a bit, because to prevent certain complications. So, but within some 2 weeks thereabouts, those drops are stopped. So within 1 month, if you had those drops used, your vision will be back fully to what it was before. Okay, so but you would also see that first day post-op you're good. All right, so but occasionally there are some complications that might come up. And which are manageable complications most times, and I don't think I need to bore you with what different things well, let me say one or two that are very common.
Okay.
Because usually, remember I said a channel is created for fluid to come out into another part of the eye. Now, so you must raise some tissue, some part of the body, flesh, for where the fluid will come out to. If the closing is not very tight, or if the suture, what we use to sew the eye, so to speak, close the place, is very tiny like an hair strand, or even tinier than that. Yeah, so if somebody coughs or strains at stooling or urination, like men who have prostate problem, it can cut those sutures, and so where it had closed up, it can open up and it can leak. So the wound, so that's the most common complication, that you could have a wound leak.
Okay. Okay. Well, ladies and gentlemen, we are still discussing right here Chibike James, as well as Dr. right here in the studio, Professor Kizo Akeriwe right here in the studio with me, and today's discussion is centered around the topic that says surgical management of glaucoma, what patients should know. And I'm sure you are getting very informed as to what we are talking about right now. Let's get to open up the phone lines. I see your calls already, so feel free to call and ask your questions. The numbers are 0704-550-2840, 0909-771-1009, and you can also call 0902-311-1009. To the phone lines we go this morning. Hello, good morning. Hello.
Hello. Hello, can you hear me?
Yes, I can hear you. Good morning to you.
I'm Elder Okoro from Abate State.
Elder Okoro, good to have you.
Hello.
Elder, I can hear you. Go on.
Hello.
Elder.
Elder Okoro from Abakar State.
Good to have you. Proceed.
Thank you. I want to thank the folks on the studio for the
Thank you.
Elder, maybe you call me back, okay? Hello, good morning.
Hello, good morning, sir.
Yes, good morning to you.
Good morning, sir. Yes, I have a question,
What's
I'm calling from KDC in Kansas of the Lagos.
Christopher, good to have you.
My question is that at what stage will Glaucoma and the surgery will make the case to see again? Second question. I don't know whether I understand my question. Second question. If this is already blocked, if the patient is not seen again, can surgery achieve anything? I don't know whether I understand my question.
Sure, we understand. At what stage is surgery needed, and if the person is already, if vision is already lost, can surgery bring back vision, Abi?
Yes.
All right, just keep listening. Prof would answer the question. Hello, good morning. Hello, good morning to you.
Good morning, sir.
Hello, good morning.
Good morning, ma.
Yeah, good morning.
Okay, this is Angela.
Angela, good to have you.
Okay, I just want to ask the dog in this picture there. What of, like I am blind, but sometimes I see this shadow. What is coming to my front or what is standing on my front? What can they do to the vision?
You can see shadow and you're trying to know what can be done to improve that shadow to something else.
Yes.
Okay, thank you, Angela. Let's just take one more call before Prof answers the questions. Hello, good morning.
Hello?
Yes, good morning.
Good morning to you, sir.
Yes, morning, sir.
I didn't get in the studio.
Yeah, good morning.
My name is also.
Welcome.
So I want to ask a question. There is time if somebody has a Android phone, there is an app that so that they may call by itself.
Old soldier, I'm struggling to get your question.
Okay, are you hearing me now?
Yeah, can you move away from your radio set?
Okay, no, I'm speaking through my phone.
Okay, go on.
Okay. There is a day I heard from the program saying if you use an Android phone, then the link to the app when to help you to make calls because it's difficult for me to make calls through button phone. At that I thought some people to make calls for me, they go they stop them, they will go. Then I bought some Android phone now at 10. I found some people to download and to the app for me, they say it's not possible. I said if they can help me, tell me how I will go, if you know I can come to the office or for that sort of person or every Friday. Let them help me download to the app where to help me the call to make up my actually they make up myself. So my question.
Okay, not very sure I get that, but thank you, Prof. You had two questions or three.
Okay. Yeah. So, at what stage is surgery needed? The surgery can be needed at any stage, whether mild, moderate, or advanced. But I mentioned earlier that once it's advanced, our tendencies to advise surgery. But there's also a level of advance it will reach, and you don't do surgery because the anything remaining can now go. So but usually that, but sometimes you can even do it while it is still early if it's not responding to anything else, and then when it's young people that are involved or affected, we do surgery. If he's not responding to any medication, any laser, we do surgery. Yeah.
And he also asked if vision is lost,
Yes,
and surgery is done, can
can
something come?
somebody, yes. Now, all treatment for glaucoma does not restore vision. They do not restore vision.
None restores vision.
None restores vision. So the aim of the treatment is to maintain what is remaining. So, and that's why the earlier the better. While you still have something you're seeing with. Otherwise, the treatment does not improve vision, and which sort of directly answers also Angela's question that
Shadows.
yes, if the eye is blind, occasionally the eyes are blind, and they see things, but they are blind. It's a phenomenon, and which nobody can do anything about. But if the eye is not totally blind and still sees a little, okay, then there are some things we call low vision aids that could, improve that little vision remaining, depending on the type. Okay, and so that's where one can do something about. Then the last caller said something about the Android phone. Yeah, I would advise the person comes to either the teaching hospital, Park Lane, and ask for Dr. Keke, or the eye specialist hospital and ask for her, Dr. Keke. She would help him and put him through on what to do with his phone.
Oh, okay.
Yeah.
Prof, at the beginning of the program, you said something about there is a common myth or fear that surgery is not needed for glaucoma. Can you expand on that?
Yeah, thank you very much. Yeah, I don't know when this information started, but I know sometime earlier glaucoma surgeries used to have a lot of complications. So I don't know if that was when it started. And so they feel, if you do glaucoma surgery, you will go blind. Okay, but glaucoma surgery has undergone a lot of modifications that the modern glaucoma surgery now hardly resolves in blindness. So we want to use this opportunity, like I said, to mention to our people, to inform our people that surgery is done for glaucoma. Do you have glaucoma out there and your eye pressures are not being controlled, they are not low with the medications you are using, then you're a sitting duck, which means that you're just waiting for blindness. Please go and do surgery. Ask your doctor about it. Don't wait for glaucoma to blind you. You can do something about it. Surgery can be successfully done and the eye still retains its vision. Now, sometimes after surgery, the eye develops cataract. Yeah, so, and when cataract develops, vision goes down. So some eyes that have had glaucoma surgery and are no more seeing, it's because they developed cataract. But the patient just accepts it as their fate and doesn't do any. I did surgery and I went blind. I mentioned here some while ago a lady we saw at in one of the hospitals, and she had been blind for 13 years. And when she had surgery, glaucoma surgery in both eyes, that's like 15 years earlier. And so she's been known in the community as a blind woman, so, and then they brought her. And when we looked at it, very dense cataracts. Are you with me? Very dense. There's a level cataract reaches and it becomes a problem if you haven't removed it. So her own has reached that stage and passed it. So, but we were able to successfully operate on one, and she began to see again.
Wow.
And it was just that her son said, just go and see these people, just in case. She said she's been blind for 13 years, it is now. and she just came just to avoid his son's problem, and that was it. And she began to see, and people were milling to her house like,
Miracle.
miracle of the year. And indeed it was a miracle. So but at least we were able to restore vision in one eye. The other one it was gone.
Wow.
So it's when you have done glaucoma surgery and your vision goes down, don't just stay home. Go back. It might just be cataract that has developed. Okay, and that can be removed and you can start seeing again.
All right, just before we wrap up in just a minute or so, what advice will you give to glaucoma patients?
Yeah, the advice I want to give to glaucoma patients and relatives of glaucoma patients,
And even their families.
that's it, is first of all, for their families, check, and friends and listeners, check every year to make sure that you don't have glaucoma, and if you do, something can be started, treatment can be started. Then secondly, if you have glaucoma and it is not responding, ensure you know your eye pressure if you have glaucoma, and you know what the pressure targets, the target pressure the doctor wants to achieve. If you're not achieving it with the ordinary other means, please request for surgery. Yeah, and also know that the earlier the better, because whatsoever you have lost can't be regained even through surgery.
All right, thank you very much for that valuable discussion and insight. Well, dear listeners, today's discussion has helped us to understand that glaucoma surgery is not something to fear. It is an important treatment, often a treatment option that can help protect vision that remains when other treatments are no longer enough. So remember that glaucoma surgery helps lower eye pressure. Remember that it is performed to protect the optic nerves. It usually does not restore vision that has already been lost, and early treatment offers the best chance of preserving insight, and most importantly, regular follow-up with your eye doctor remains essential. If you or someone you know has glaucoma, do not delay seeking professional medical advice, because early intervention can help prevent further vision loss and improve long-term outcomes. For more information, support as well as guidance, you can contact the eye specialist Hospital Tesh on 0809 700 2020. Once again, 0809 700 2020. Thank you very much for listening, Chibike James, as well as Professor Nkiru Kizo Akarewe. She is a consultant ophthalmologist, ISUT Teaching Hospital, Park Lane, Enugu, and Governor representing Africa World Glaucoma Association Board of Governors. Prof, thank you very much.
Thank you very much.
All right, this program returns same time, same station next week, Friday.